Hello everyone, Dr. T here today with your Q&A. Dr. T, I am having lots of burning, itching, swelling, redness, and bumps in my vagina. What could it be? Um, those are some concerning symptoms. However, it's not enough information. It could be a yeast infection, it could be an STD, but I don't know if you are even sexually active. So give me a call and we can discuss it. Dr. T, I'm having lower abdominal pain and back pain, usually after sexual experiences. Well, that could be for a number of reasons. You could have a very sensitive endometrium, you could have cysts, or you could have a back injury. Could be a number of things. I would need to discuss this with you to get more information to see how long you've been experiencing it and how long it lasts after you have sex. So give me a call. Hello, Dr. T. Can I get genital herpes if I touch my lip and I have herpes actively and then touch my genitals? I would not advise that you touch your genitals after having touched your lip or anyone else's genitals for that matter, as you could definitely spread it. If you would like to discuss natural treatment options for herpes, give me a call. Dr. T, I've never had a vaginal boil before, but just the other day I noticed one on my labia, followed by a fever and swollen lymph nodes. From what I've read, this means I need to see a doctor. However, I don't have health insurance and can't afford it. Should I be okay, or is there anything that I can do at home? Okay. Well, it's very difficult to say. The fever is concerning because that is an indication that there is bacteria in your bloodstream. So, what I'm going to ask you to do is to give me a call. Health insurance is not required. I also offer payment plans and financing. So, I'm sure we can work something out. All you need to do is reach out directly. Dr. T, my doctor prescribed me metronidazole for trichomonas. However, my boyfriend's doctor prescribed him doxycycline. Are we being treated for the same infection? To answer your question, yes. So metronidazole and doxycycline are both known to be broad spectrum antibiotics. They both treat trichomonas, even though metronidazole is the primary go-to for it. I don't know, maybe your boyfriend has an allergic reaction to the metronidazole or something in its class. I'm not sure, but there's no cause for concern. And if you would like a natural treatment as well for the both of you, we can discuss that. All right, Dr. T, I have not had my period for 6 months. I just got it today, but I still need to go and see a gynecologist, or should I? You definitely should, and I would have recommended that you do so after 2 months, considering that you're saying that you were not pregnant. 6 months going without a period at your age because you're not pre or even peri or postmenopausal is concerning. Let's see, you are on birth control. That could be the reason for the imbalance, but 6 months is a considerable amount of time. So you definitely should have some labs run. Dr. T, I have been bleeding for about a month. My period usually lasts 5 days. However, I've noticed spotting here and there, and it's now getting heavier. Is it even my period? Well, it's difficult to say. You could be passing a cyst. It could be a number of things. I'd have to know if this is something that has happened to you before, how heavy the bleeding is. Ideally, you should have some lab work done to see if your blood count is normal at this point, or if you've become anemic due to it. So get some blood work done. And if your bleeding hasn't stopped and you're not having a miscarriage, then we should do something to balance out your hormones to get that to cease. All right, Dr. T, I had sex the other day and have been bleeding since. I'm supposed to get my cycle tomorrow, but I wanted to know, is this normal? It could be normal for you, but it is not something that women traditionally experience. You should not be experiencing bleeding after you're having sex. It could possibly be an indication that you have an infection. All right, Dr. T, it's been 4 days now from when it started. I have a sharp pain under my left breast, and I'm not sure what it is. Well, I would love to be able to tell you what it is. However, I don't have enough information. When our hormones are fluctuating, it is normal to get sharp pains in and under your breast. Again, but I don't have enough information from you to really be able to um, assist you with which direction you should take. All right, Dr. T, I'm having vaginal bleeding now for several months, not on my period, no cramping, and I'm 40 years old. Okay, I'm glad you're not having any cramping. However, several months of consistent bleeding is definitely a concern. Okay, ladies, of the hundreds of questions that I get in regularly, I'm going to say about 40 to 50% of them are regarding irregular bleeding. So, like a fever, abnormal bleeding is an indication that something's wrong. It could be as simple as your body expelling a cyst, or it could be a result of a disease, disorder, or hormonal imbalance. What I'm seeing an increase in that's really concerning me is a relationship between abnormal bleeding and the use of either oral or device inserted contraceptives. So this is your body reacting to it as a foreign object or substance. So it's struggling to find a balance to accommodate it. Unfortunately, frequent use tends to end up in reproductive disorders and infertility. That said, you should know that there are other options. I do discuss some of these options in other videos, and we'll do so further. But as always, I encourage you to reach out. You can do that again by telephone, by secure message, by email. I'm always here to discuss. Don't forget to like and subscribe, and I hope to hear from you soon.